So this report is about care coordination programs. So what care coordination is, why it's needed, as well as the programs that we have delivering care coordination services in Connecticut. So it identifies some trends, some gaps, and provides recommendations for how we can strengthen care coordination in the state. Care coordination programs, from our view and for the purposes of this report, were really programs that have intentional efforts to support communication and collaboration across different service providers to improve outcomes for families.
So care coordination activities include assessing the family's needs, developing a plan of care, making referrals, following up on those referrals, providing transportation sometimes if needed, and ideally the care coordinators are bringing the family's team together, inclusive of professionals as well as those natural supports in the family's life, to really support implementation of the family's plan of care and reaching their goals.
So I think the philosophy of care coordination is making things simpler for the families and getting everybody on a single plan of care that's really driven and built around the family.
A lack of care coordination can lead to inefficiencies in the system, duplication of services, and confusion and added burden for families trying to coordinate their own care.
Families that have a child with special health care needs oftentimes are reporting that they want help navigating this, but they often aren't getting it. So we know that about 40% of the time, these families are saying they would welcome help, they need help, and they're not getting it. And the families that are least likely to get it tend to be when there's a behavioral health concerns with the child, children of color, and then income issues. So either lower income, potentially not having insurance, or being on public insurance. Those are all factors that make these families less likely to get the care coordination services that they want and need and deserve.
So one of the strengths we have in Connecticut is really a tremendous number of care coordination programs. And we have efforts going on at the system level. We have the Connect initiative, which is really working to support across child serving systems. And then we have also a variety of direct service care coordination programs really providing tremendous services. One example of that is the wraparound model. It's a national model, but we have it here in Connecticut through RAP-CT care coordination. They're guided by 10 principles, such as family voice, family choice, individualization, cultural competency. And one recommendation or opportunity that we see when we look at that model is to expand those principles. Those principles can really guide many of the other care coordination efforts that are going on in the state. And other opportunities we see to strengthen care coordination is to really further integrate the physical and behavioral health services and systems of care. Another opportunity we see to strengthen in Connecticut is really to expand the care coordination programs in addressing social determinants of health, addressing trauma, looking at underlying conditions such as health inequities, racism, and really addressing health from that broadest perspective.
The people that should read this report are leaders in systems that are serving children, policymakers, as well as care coordination program staff and those that are running programs in the state.